And in our next segment, the question is, are spinal manipulations necessary with conjunctive care and acupuncture? And absolutely they're necessary, because if we talked about this in a previous segment, but it's so cool how the connection is made by the Chinese, and we just kind of carried that forward. But the connection is, when you look at the 12 meridian pathways, those are very popular and well-researched pathways in Chinese medicine, over 4,000 years old, and that's the way they can diagnose and treat conditions. One of the pathways, called the conception vessel, comes in the front of the spine. And then the other one, called the governing vessel, and hence the name, because it's talking about the spinal cord, which governs our life force, our innate intelligence, our God created intelligence, and our chi, our energy flow. And so those two meridians go right over the spine. And that's what I find is fascinating. Me being a chiropractor, this is the perfect connection, the perfect introduction to our patients on how to help them and how to bring the two worlds together. And so you absolutely need to adjust the spine to increase the nerve flow of that particular meridian, and vice versa. So you need to acupuncture that meridian and then manipulation at the same time to get the healing process of the bone, the disc herniation, or the ligament and muscle to heal at the same time. And what that looks like in the spine, okay, so now we did acupuncture, so we did manipulation, that increased the flow of the meridian, but then we do acupuncture, and then we're going to increase the flow going to a particular disc. So this will stimulate the electricity, 8 to 10 hertz, around this area, so that it heals faster, and it causes cell proliferation, causes an increase of glycosaminoglycans, an increase in water to that disc, and lubrication in between the disc and the joints. So that's how the two worlds really connect, and in our practice, they're the same world, and everybody gets adjusted and everybody gets acupuncture in our office. That's how the Chinese did it, and that's how we'll do it.